Am I at risk for hyperthyroidism? Imagine your thyroid gland as a tiny butterfly-shaped organ in your neck that helps control your energy and metabolism. Sometimes, this gland can become overactive and produce too much thyroid hormone, leading to hyperthyroidism. But who is more likely to develop this condition? Several factors influence your risk. Women are more prone to hyperthyroidism than men, especially those over 60. If you have recently been pregnant or have given birth within the last 6 months, your risk slightly increases, likely due to changes in your immune system during and after pregnancy. Having a personal history of thyroid problems such as goiter or thyroid surgery also raises your chances. If you have a family history of thyroid disease or autoimmune conditions, your risk goes up too. Conditions like Graves' disease, which is an autoimmune disorder, are common causes of hyperthyroidism and tend to run in families. Other autoimmune diseases like type 1 diabetes or pernicious anemia, which affects vitamin B12 absorption, can also increase your risk because they involve immune system dysfunction. Your iodine intake plays a role as well. Consuming too much iodine, whether through diet or supplements, can trigger hyperthyroidism in some people, especially if they are genetically susceptible. Certain ethnic groups have higher rates of thyroid disease. For example, Graves' disease is more common in women and tends to affect African American populations more frequently. Less common causes include toxic multinodular goiter, toxic adenomas, or thyroiditis, which is inflammation of the thyroid. Some tumors that produce thyroid-stimulating hormone or mimic its effects can also lead to hyperthyroidism. Symptoms to look out for include feeling nervous or irritable, having trouble sleeping, experiencing rapid heartbeat, weight loss despite eating normally, feeling unusually hot, or having hand tremors. You might notice your eyes bulging or an enlarged thyroid gland called a goiter. Because symptoms can vary and hyperthyroidism can sometimes be mistaken for other conditions, it's important to see a healthcare professional if you have risk factors or notice these signs. Regular checkups and blood tests that measure thyroid hormone levels can help catch hyperthyroidism early. Early diagnosis allows for proper treatment and helps prevent complications like heart problems or weakened bones. If you think you might be at risk, talking to your doctor is the best step. They can evaluate your personal health history, perform necessary tests, and guide you on managing or preventing this condition. Remember, everyone's health is unique, so personalized medical advice is essential.